All right, so today we're looking, sorry for the break. We're looking at storage of health commodities. The last time, I think we've already done storage and we've done storage and inventory control. But there are portions of the storage of health commodities that we did not tackle. So I want us to look at those areas. So there may be some portions that we have already treated in our past lectures. So, but the majority of them, we haven't done it, which I think is important. So when we talk of storage of health commodities, as I indicated in our previous lectures, you realize that health commodities are delicate and complex. And due to the delicate nature, when it comes to the handling of these commodities, we actually take a very serious look at how they are stored, the condition under which they are stored, the equipment used in storing them. If you don't get the appropriate ones, then you make the product ineffective. And when it comes to health commodities, one danger is that when they become contaminated, sometimes you cannot see it with your naked eye unless you do clinical trials, laboratory, what they call it, examination, before you'll be able to determine whether a particular drug has defect, some form of defect, some what do you call it? There is that kind of contamination or something. You can't see it with it. So it becomes very difficult when it comes. That is why it is always important that they are handled properly. So let's start with receiving health commodities. When you receive health commodity, you first must ensure that you have sufficient space to store the items. There must be enough space to store the items, and then you make sure that the environment is clean. You prepare and clean the areas used for receiving and storing the product. And another aspect that we've been talking about is the inspection for damaged or expired products. We need to inspect it to see whether some are damaged, some are expired, then you remove them from the usable stock. You also separate the damaged or expired stock from the usable one. If damage or expiry is discovered while the delivery truck is still at your site, refuse to accept the product and note the problems on the delivery note. But then the convention is that you only receive items that are usable. So when items are delivered and you detect some defect, you realize that the items are expired or damaged, you reject them, you don't accept them. But I know that there are also instances where you accept them, but you'll be given delivery note where you indicate the quantity of stocks that you have received, those that you have rejected, and then you state the reason why those items are rejected, why those items will not be accepted. You need to indicate on the form. But some instances, when you indicate them on the form, you still take delivery of the items and later on return them. And that comes under the returns management. You return those items that you have identified. But in the other scenario, you don't take delivery of those items in the first place. So if damage or expiry is discovered after the delivery truck has departed, follow your facility procedures for handling damage or expired product. In situations where you were unable to detect whilst the delivery truck was in your premises, and you later discovered that some of the items are damaged or expired, then you follow the procedures that you use to handle damage or expired stock. Follow that process to solve the problem that you can encounter. Another one is that you count the number of units for each product received and compare to issue voucher. So this is normal, it's obvious. Anytime you take delivery of stock, you need to count, make sure that it tallies with what is on the voucher before accepting the items. Then you record the date and quantity received on stock card and the bin card if applicable. In situation where you still use the bin card and then the stock card, you record the items that you have received on them. And you also ensure that expiry date is visibly marked on every package or unit. Know there are some items that you don't see the expiring date. So sometimes you see they are in, but then unless you remove that leaflet before you see them, so when you see that, you need to write it visibly, mark it visibly on the package so that everybody can see. You arrange product in the storage area to facilitate the first to expire, first out policy. So this time around, under this one, you don't follow the FIFO-LIFO. The FIFO-LIFO, talking about first in, first out policy. This one, we are not going by the first in, first out policy. We're going by first to expire, first out. So the way you receive items, that is not the way you have to issue them. It doesn't necessarily mean that items received first will be issued first. You look at their expiring date. If the item, the ones that will expire first, you issue them. That is the policy. So let's go to arranging commodities. And before we go to arranging commodities, I would like to find out if you have any question, any contribution with regards to what we've done now before I proceed to arranging commodities. Okay, so without any question, let's go to arranging commodities. This aspect was part of what we did under the storage and inventory control. So when in the storeroom, when you are arranging commodities, if we are using pallets, stack cuttings on pallets, what you do is that the item shouldn't touch the floor. You shouldn't put the box or the cutting on a bare floor. At least you need to have some platform, or you can talk about the pallets, and then it should be at least 10 centimeters above the floor, the ground floor. And then it should be 30 centimeters away from the walls or the stacks. It means that curtains or boxes might not touch the wall. It should be away for ventilation. And the product, in terms of the height, you shouldn't store them on. It shouldn't go too high. It shouldn't be more than 2.5 meters or 8 feet. It shouldn't be too far. Other than that, when you're removing them, you struggle, especially if you don't have. You may have ladder. You may have ladder that you may use to climb, but you know that it's not everybody that can. Even when you have the ladder, it's not everybody that can climb, depending on the stature, depending on the weight. So the ideal thing is that you store products at the height that the average Ghanaian, which means that it shouldn't go far. Okay, I don't know whether that's true. If you say the average Ghanaian, um, what is the height of the average Ghanaian? Normally, UNSS normally take the height of people. What is the average? What is the height of the average Ghanaian? Hello, payo. I think you do that. Sometimes people come, you take. There are instances you take those. So, what is the average? What is 4.8 feet? Somebody is saying 8 feet, 1.7 meters. Is it? So that is the average Ghanaian height. So 8 feet, which means that if you have 8 feet, it means that you still may need a carrier. You need a ladder, or the ladder or something to stand on to be able to pick it. Especially when you are dealing with heavy items. Heavy items should not be stored. Where you put them shouldn't be too high. And then when it comes to liquids, like syrup, shouldn't be stored, shouldn't be put on top, because when they fall, it can also cause a lot of damages. So the storage, the height, and everything that is very, very also, yeah. Then let us look at, so you follow, when storing, you also must follow the manufacturer's ship or the shipper's direction when stacking, and follow labels for storage conditions. When it comes to storage conditions, always you have the manufacturer's or the shipper's instruction where they tell you how items might be stored. Sometimes the temperature, that is why the Pharmaceutical Council, they don't allow drugs to be sold in the metal containers, because metal containers, looking at our weather, they produce excessive heat. Okay, so it's not advisable that you sell drugs like over-the-counter pharmacy shops. They are not allowed to operate in those containers. And you place liquid product on the lower shelves or on the bottom of the stack. So as indicated, liquid product should be stored at the lower level. And then you store product that require cold storage in appropriate temperature control zones. Some product require, what do you call it, special storage, what do you call it, areas. You have vaccines and other products that you need. So those items, I'm finding out from facilities that do not have electricity, as I said, electricity. We still have some that do not have electricity. How do they maintain? How do they ensure that the products are stored in the right condition? There was a hand up. Can you talk? There was a hand up. Somebody raise a hand, or the person is not ready to talk now. All right, let's continue. So I was talking about products that require special storage condition. And these products, you see, sometimes we take a lot of things for granted. And I always, and I've been saying this, I think since we started, I've been asking this question, and it still worries me. Okay, so I've been saying that probably after this lecture, I'll talk to somebody close to me. I'll find out why, like the uh, antibiotics, the suspension, the one that we give to children, anytime you mix them with water, you mix it with water, you are supposed to keep them in the refrigerator. So in situation you don't have refrigerator, how do you um, keep this item? How do you store it so that you can maintain the quality and then the safety of the product? Is putting it in water solve that problem? You are necessary, and some of you operate in an environment where people don't have access to refrigerator, even where there was electricity. It's not every home, it's not everybody that can afford. Okay, so when you put it in water, is it able to maintain the quality and then the safety of the product? And I'm asking you a question. You are nurse, so I want to find out.
Yeah, please come again with your question.
Question is that if you look at antibiotics, anytime the suspension, anytime you miss it, they tell you to put it in refrigerator. Where you don't have refrigerator, water should be the option. And the question is the water, putting it in water, is it able to maintain the efficacy? Is it able to maintain the safety of the product? Yeah, and somebody is saying that no. So that it's been a challenge to me. I've been asking myself and thinking about how that problem can be resolved in a way. Have you probably nobody has taken the trouble to run a test in those areas? If we talk about ice cubes, you see, ice cubes, when you have access to it, for instance, you buy the ice cubes from how many hours or minutes can that last as somebody has put it? So and I don't think there has been a clinical trials. Somebody has taken the trouble upon himself to test the 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 quality of such drugs when they are not kept in the refrigerator, when they add water to it. Think we haven't checked that. Yes, putting them in the pot, the clay. It is all about the water. So yes, we've done these things. We do it, and still I know a lot of people do it, especially those in areas where there is no electricity, and then the underprivileged. So we need to look at it, test it, and see You change the water frequently. And so it's a problem, something that we need to. So when it comes to storage, yes, in our facilities, in the cities, towns where there was electricity, those who can afford a refrigerator, even in the hospitals, that one, what they do is that even if they don't have refrigerator, they keep it in the nearest, what they call a center that is able. And these days, most of the, especially those in the rural areas, are being given solar power so that they will be able to do it. But after dispensing the drug to the patient, what happens? That has been my worry. That has been my challenge. Because even the temperature, it is because of the temperature that they want it to be in the refrigerator. So once it is not in the refrigerator, the temperature will not be the same. The temperature changes. And then once there is a change in temperature, then there is a problem. There will be a problem somewhere. Yes, sometimes alternative drugs may be the capsules as to whether the children giving them capsules, sometimes they break them into two or something as to whether when you break them, you can get the correct strength. The strength that you have will be accurate is also another challenge. So I believe that there should be alternative so that these items should be made, what do you call it? Uh, so it can be easily dissolved in water. When you put it in water, it should be able to dissolve quickly, like most foreign taps. You know, in UK, most of their taps, paracetamol, you put it in water, it dissolves, and then you drink instead of chewing it. They have um but because they know that a lot of people throw them away because of the chewing. And so even what they call drugs, they try to what they call it, sugar coat it. They want to make it taste nice. But still we continue in our part of the world, we continue to drink the bitter ones. Even babies, we still give them the bitter ones. Everything of we think that if it is bitter, then the potency, it has high potency. I don't know. But if you take a lot of foreign drugs, especially those that are given to kids, um, it is sweet. And so the children are able to, and it still has the same effect. It is able to work. So we need to work around it and make sure that we make things easier. You see, in our part of the world, everything is so difficult that sometimes we don't want to move away from the old way of doing things. Then you store high security, high value products in appropriate security zones. There are products that are addictive. Some products are abused. Some products are highly abused, even by health professionals. And then with some of them, because of uh, the restrictive nature, those products, you cannot sell them in the open market. And so they have high black market value. And so it is easily stolen if you don't keep those drugs well. So such items we talk of high security uh, zones, products that require high security or high value the products are expensive. And so people, the possibility of people trying to steal it is very high. So you try to keep those products away from uh, it being stolen easily. So all these ones you need to look at it. That is why we say that when you are receiving the item, you make sure that you have enough space. When you talk of space, we are looking at all the security, the condition, the temperature, cold storage facilities. You look at all these before you make order. Then you separate damaged or expired product from the usable stock without delay, and dispose of using established disposal procedures. These ones we talked about them. You always store all commodities in a manner that facilitates the first to expire, first out policy for stock management. So realize that here we've emphasized the emphasis on the first to expire, first out, unlike talking about the first in, first out, last in, first out. The FIFO-LIFO policy doesn't apply here. So here you always look at the first to expire product that will expire first. Then you dispense those products. You need to arrange cutting so arrows point up and identification labels, expiring date, and manufacturing date are visible. If this is not possible, write the product name and expiry date clearly on how you arrange them. You arrange them. So the focus is you making sure that you prevent excessive expiry, because some of these, if you don't follow this policy and you issue them anyhow, you may end up having a lot of expired products. And so we talk about the expiring date and manufacturing date. Why is it that the focus, mostly the focus is here? Because as I indicated, these products are delicate, and if you don't take care, people also prefer the manufacturing date. Experts will prefer the manufacturing date because with the manufacturing date, they are able to determine whether the shelf life given to the product is appropriate. Because you first must look at the weather condition. Yes, you may have, the manufacturer may determine that, okay, for this product, the shelf life should be maybe 2 years. But the expert who in that country can also say that, looking at the storage condition, for instance, these antibiotics, normally when you give it to children, you say that they should use it for 7 days. So if it is not in the refrigerator, then the 7 days cannot be possible. Because already the first, second day, a lot of things may be happening. So you cannot assign the same shelf life. And that's why I'm saying in that some of these things we need a laboratory or examination to determine whether it has effect or not. So let us look at stock rotation. So when issuing product, it is important to follow the first to expire, first out policy, and then this policy minimizes waste from product expiring. Because if you do that, then you are able to determine, it means that you practice the perpetual inventory counting system or the continuous inventory counting system as we did. With the continuous, you are always monitoring the stock so that anytime you detect anomaly, or expiry, you remove them. And so you always issue products that will expire first, ensuring they are not too close or they are not close to or past the expiration date. The shelf life remaining must be sufficient for the product to be used before the expiring date. To facilitate the first to expire, first out policy, you place product that will expire first in front of the product with a letter expiring date. You write the expiring date on the stock card so stocks can be sent to facilities at least 6 months before they expire. And they're saying that 6 months, this is the best case scenario. One disadvantage of sometimes theories is that theories always look at the best case scenario rather than the actuals. Because in our part of the world, this might not happen. You cannot reject product. They send product to you and say that you're going by the convention. The product should have, the shelf life should be at least 6 months. It doesn't happen because sometimes in your facilities, a month to expiry, they bring them and you cannot reject it. So this is the best case scenario. When we talk about the best case scenario, then it should be 6 months. Anything less than 6 months, you reject it. So products should come in 6 months before the expiration date. But in our case, that is not possible. Based on our circumstances, based on other factors beyond your control. So remember, the order in which you receive product is not necessarily the order in which they will expire. Product you receive most recently may expire sooner than the product you received earlier. So it is extremely important to always check the expiration date and to make sure the dates are visible while the products are in storage. So when you do a product that you receive today may have a longer shelf life than product that you may receive by within a month. So you need to look at all these, and then you, based on that, you manage your stock efficiently. Okay, so we're going to look at the early arrangement of essential medicines, and I would like to know if you have any question, any contribution. Any question or contribution? Okay, give him about 2 minutes. I'll be with you. Okay, so no question. Let's move on. Let us look at the orderly arrangement of essential medicines. We have so many ways, depending on the individual and then their expertise in health, what they call it, commodity management. And so let's look at some common systems for arranging medicines. First, we have the alphabetical order by generic name. So when you talk of what is generic name, sometimes we have generic drugs. What is it? What is generic drugs? Okay, so if you talk about the official name of the drug, like we talk of paracetamol. So you talk of paracetamol, and then you may put all the paracetamol under all paracetamol. Maybe you may have Xenol, but the Xenol is the brand. Xenol may be the brand. Letab may be the brand. The MNG may be the brand. So you talk of paracetamol, and that becomes the generic name. So you can arrange them according to that one. And then this one is often seen in both large and small facilities when using the system. The labeling must change when essential medicine list is revised or updated. So anytime you change the essential medicine list, as I mean currently, when you talk of malaria drugs that we currently use, at first we used to have, currently is a artesunate, you have the artesunate there, we have others, but we also have other brands that might not be on the national essential medicine list. So anytime you update the national essential medicine list, you have to also change the labeling to reflect that one. Then we have the therapeutic or pharmacologic category, most useful in small storerooms or dispensaries, where storekeeper is very knowledgeable about pharmacology. So these ones too, you can arrange them according to the therapeutic category. And mostly when you use it, you see, when you are dealing with the pharmacist, they understand the way they arrange the items. So some of them, they can arrange them according to ailment. So if you pick, let's say, analgesic, they put all of them in one area. They can talk of malaria, drugs, they'll put all of them in one. Then the hypertensive drugs will also, they understand them. And this is the way they arrange their, you can also arrange them according to all, per their, what do you call it, per the pharmacology category. And this is one experience that I had. Immediately I completed school, I had to work with my uncle in his pharmacy, a very big, one of the large pharmacy shops in Kumasi. And I was put in charge of the wholesale. It also wasn't the type of wholesale, not the normal wholesale we see built people. This is a story building that he rented. So the top and down hard drugs, the top and down, because the room wasn't designed for warehouse. You have different rooms. So the items are stored in different rooms. And when I went there, it wasn't easy for me. We were always having issues. Because you ask you, they'll bring the list, you go and bring the item, you go in your room, you move from this room to that room. And when he realized that you are keeping on, then he will leave the retail outlet and climb. So, oh, this thing is here. And then it got to a point in time, it was becoming too much. So one time he traveled, I think he spent 2 weeks outside the country. By the time he came back, I had rearranged the entire warehouse to the alphabetical order by the generic name. I had done that. And so when I did that, the wife was also very happy. He said, oh, so when the wife came there, the first thing he said, hey, I think you've arranged the place to the point that me too, I can work here without fighting with your uncle. Then he came. So when he came, hey, yes, what boy, warehouse. Then he went there and he saw it okay. But he being a pharmacist was more what do you call it, for the therapeutic, because that one, if it is about malaria, he knows where to pick the malaria drugs. But he said, most of us working here are not pharmacists. You are the only pharmacist here. So if we arrange it that way, people wouldn't, because when the items come, you wouldn't know whether this one is used to treat this ailment. It will take you some time. You need to ask before you know that these are, and then doctors too, when they give prescription, they don't indicate the ailment on the prescription form. It's the drugs. So the pharmacists, they will understand, they will know that these drugs are used to treat these conditions. But you, the other professionals that being an accountant, being a salesperson, or the procurement person, you wouldn't know what, you are not interested in that, your treatment. You're interested in how to get the items for them to work. And so, and I think that is how I remember there are some specialized drugs that later on, almost the entire warehouse was changed to that, the alphabetical order for everybody to work in there. So, but then for the pharmacist, if you are working with I know that in the pharmacy shop, the hospital pharmacies, normally they use the therapeutic because those there, you always have a pharmacist and experts who understand. So you prefer that. But then others too use the generic so that it will be faster for other people to. Then we talk of the dosage form. You can also arrange them health commodities according to the dosage form. Then medicines come in different forms such as tablets, syrups, injectable, and external use products such as the ointments and creams. In this system, medicines are categorized according to their dosage form within the area for each form, and mixed. A fixed fluid or semi-fluid system is used to store items. Any of the other methods of the categorizing can be used to organize the items more precisely. So you can also use the dosage form. You say that, okay, syrup, you can put all syrup in one area, all injectables in another area. External, like the ointments, you can also put them in another area. And then you can also talk about the phase fluid, the semi-fluid system. You can talk about what they call tablets, capsules. You can also arrange them. It's also another way you can use to arrange your medicine. And then we have the system level. What is system level? We talk of items for different levels of the healthcare system. They are kept together, sometimes in a pack. You can also talk about kits. This works well in stores at a higher level when storage of kits is required. So you can, for instance, when you are doing wound dressing, you have items that you use. So you can say that you categorize them if you are talking about infusion, you don't only use it. So you look at the kits, all the items you use when you are doing transfusion, all those things, you can put them together as one. So you store them. I remember when I was doing my national service as Drobo, St. Mary's Hospital. This is what we were doing. Normally Tuesdays, currently Tuesday is the market day for that place. So Monday when we go to work, we start packing because you have the pregnant women, malaria. We know the dosage, so we normally pack them in this what do you call it, plastic envelopes. Okay, so for the pregnant, we know the iron, we know the folic acid. We talk about the multivite. You put them. We know the dosage. We know the quantities that are given, and so we count them, and then we put them in the rubber envelopes. The rubber what they call it envelopes. We pack them, then we put them together. So the moment you come, and then we get the prescription, you pick this one, you pick, and then you put it together. This is to reduce the time that they spend in the what they call it pharmacy after they've gone through the antenatal. When they come for the drugs. This is how we were packing it so that things were moving fast. I remember when we finished our service and we're leaving, one of the doctors said, "You guys are really helped. You've made the work very easy for us." And that is the way that is what we also introduced them. And that is how some drugs you can also arrange it. But then arranging this one is not easy. You can only do that for kits or items that what do you call it? How do I put it? They are items that are used together. Let me use this word. Items that are used together. For instance, when you go to, you know that you can't give item A. In those days, when they used to give multivite, anytime they give you multivite, the small, the red one, they add folic acid to it, especially if you had malaria. But these days, most of the drugs combine them. So these days, when they even give you, when you have what they call fever, we're not giving some of the drugs contain. I know the ones that are given to pregnant women. There's one particular one. I think it contains the iron, the folic acid, and then the multivite. So these days, you don't see them taking a lot of pills. In those days, you go to hospital, they have a lot of them have different pills. These days, they don't do it because they've combined them. And then we also talk of, you can also arrange the items according to the frequency of use. That is, you have slow-moving items, fast-moving items, and then non-moving items. So items that are frequently used, you can use it for your, what do you call it? You can arrange them that way. So you look at, and this one too, you can't do it for all the items. It depends on the items that you can use. Like I gave you the example how we used to package drugs in the pharmacy, because we felt that when they come consistently, that has been the what do you call it? The quantity, the kind of drugs that are given to them, the dosage and everything. So you know it and you are able to package it. So this one, you can look at frequently used items. You arrange them in such a way that items that are bought frequently come to the front, and then those that are infrequently bought are also put backwards. And we can also use what we call the random bin. With the random bin, you know how bins, if you have been to the facilities and you know how the bin system is. So this one, you don't follow a particular format. But what you do is that if you want to use the random bin, then the system should be computerized. You cannot use the random bin when your system, you don't have inventory management software, which is automated. So if you have automated system, then you assign code to each bin, and then you also have codes for the product. And I know whenever you have the essential medicine list, when they come with codes. Each item has a code. If you start with paracetamol, it has its own code, sometimes 001 and other things. So when you are using a random bin, you pick paracetamol. If the code is 001, you pick the bin number and then you put it in the system. So when I come and I'm looking for the item, the moment I enter the code, the item code, it will then direct me to the bin where the item is stored. Then you pick it. So you can also arrange them. You can also arrange the items according to the random bin system, where the warehouse management system, the inventory control system is automated. And this one, it has to be computerized, because you can't use manual. You can't use manual to do that kind of job. Then you have the commodity coding. With the commodity coding, each item has its own article and location code. This system has the greatest flexibility, but it's also the most abstract. When you say something is abstract, it doesn't follow any format, it doesn't follow any formula. And so this one, you use the codes. And normally we use these ones. It's difficult using this commodity coding in the warehouse. Okay, probably you can use that for certain category of items. So if you want to categorize items according to certain what do you call it, criteria. For instance, you can talk about high security items that require high security, or you can talk about narcotics drugs. So you give code. These items are narcotic drugs and they are supposed to be here. These items require special security, special storage area. You also then these items are flammable, and so we need to store them. So you can talk about the location, the commodity coding. Normally we use the location. So the moment you see the code, you know that this item will definitely be in this location due to the nature of the item. That could be, it could be flammable items that can easily catch fire. You have items that require high security zones. You also give it and then you store them. So this system works well in computerized inventory control system. This system too, it has to be computerized. You cannot use manual to do this kind of arrangement, commodity arrangement. Then we talk of special storage conditions. Some products need storage in an access-controlled environment. When you talk of access-controlled environment, what is it? It is important to identify products that are at risk of theft or abuse or have the potential for addiction, and to provide increased security for those items. As I indicated earlier on, certain items are very addictive. You can become addicted to it. It gets to a point in time, there are some drugs that if people don't get it, if a day they don't take it, they feel unwell. To the extent that it's not only those we call junkies that have that effect. There are individuals, sometimes health professionals like you are used to taking certain drugs to the extent that if you don't have them, you are unable to perform. And surprisingly, studies indicate that a lot of health professionals abuse drugs. Okay, It's not just those, and normally those who know functions of drugs normally abuse them, because when you know that the pethidine is what it can do, the other man on the street, if the person doesn't know what that drug does, they will not use it unless someone teaches them how the functions of those drugs. That is why these drugs must be stored in an access-controlled environment so that you prevent people from getting access to them and then becoming addicted to that particular items. So this includes products that are in high demand or potential for resale. So some products are in high demand, and therefore, for instance, tramadol. Tramadol used to be sold in the open market. I remember I had an accident going to Accra. I was driving. I had an accident around this place, the Islamic Secondary School, Suhum Islamic Secondary School area. And when I was taken to Trust Hospital in Accra, I was given tramadol. I took tramadol. It was a painkiller that I was taking. So I didn't. It's when I heard that it was narcotic. Later on, it has become narcotic. I was surprised because it was normal. Because it was to reduce pain and other things. And I wonder how, because it takes the health professionals sometimes to teach people the functions of certain drugs before they become, what do you call it? People begin to abuse those drugs. So usually, National Essential Medicine lists include several narcotics and psychotropic medicines. 1 or 2 will be on facility lists. So typical examples are narcotics, morphine, opium preparations, pethidine, diamorphine, piperacillin, hydrocodone, and oxycodone, dipipanon, and then tramadol. These are narcotic drugs that require special storage conditions. So are the pharmacists allowed to sell? The pharmacy shops, are they allowed to sell tramadol? Or now it is only administered at the, what do you call it? In the hospitals, not the pharmacy. They are no longer prescription drugs. So they are sold at the pharmacy. So how do they control it?
Okay, sir. Please, unless there's a prescription and then signed by a doctor before they can get the medication.
And you think the pharmacists, they follow that?
But that I can't really tell.
Because if a whole day, you see the big ones can do. The big pharmacy shops can do, because for them, tramadol is nothing. But for those in certain places, the whole day they haven't sold anything. Somebody can want tramadol, think they will not. If it depends on the person, but still people find ways and means of selling. But to me, it should be restricted. So the facilities, if a doctor will prescribe, then it should be at only the facilities, so that doctors will prescribe, and then that one they will be able to monitor. The Ministry of Health or Ghana Health Services together with the various regulatory bodies will be able to monitor. Because if we give you, and it's not all the facilities that are allowed to have them, or all facilities are allowed to have them. When it comes to narcotics, it's not every facility. It might not be part of your essential medicine list. These drugs are prescribed by the medical doctors, and sometimes they know where to pick them. So we have other opioid and strong analgesics, pentazocine, codeine, dihydrocodeine, and then we have a lot of these items that also are controlled. That no, you can't just sell them anyhow. It is not open, even if you have them in the facility. You are only giving those drugs under special conditions. It's not something that is prescribed frequently. Usually, the group of drugs called benzodiazepines, the more common being diazepam, temazepam, natrazepam, flunitrazepam, and oxazepam. These drugs are used to treat epilepsy, may be found under different class, and it's not always under the same control. So drugs that are found yeah, Prince, as for me, I know that some of them will not go by the rules. Others will go strictly by it, others will not. The big pharmacies, those with reputation, like the NS chemists, the Lancer chemists, and all those ones, will not, they may not sell. Are the ones in our communities that do not make much sales in a day. Some of them will find ways and means of selling it. Then we talk about the psychotropic drugs, as I've mentioned, and then strong tranquilizer medicines such as chlorpromazine may also be found under this heading. All these items most of them also require special permission to even import those drugs into the country. There are some drugs that you require special permission. Even if it is a pharmacist, you need special order to be able to bring those items into the country. Some of the medicines mentioned earlier are controlled substances, which are medicines handled under international control. So if you see, whenever medicines are handled under international control, then the individual may not be able to import them. You may need what do you call it? Authorization from your country to be able to import those medicines. You know, during the COVID, there was this particular Professor Planjuru, when I think it became a national issue. At the time, they had to fly the presidential jet to Kenya, to South Africa, just to get a particular drug, which under the rules in Ghana, it was not. Those drugs were not part of the drugs that we could administer, and that is the reason why sometimes people travel outside for medical care. You see, sometimes we blame politicians, and where I sit, I know individuals. They are not politicians that travel outside for medical care. A lot. So the moment you become a politician, then you become a target. Yes, they are not doing things right, but as individuals, assuming the person is not using the state funds, but they are using their own money, then I don't see the reason why some of them cannot get treatment outside, unless it is establish that the person is using the taxpayers' money. That one, you need to. You know that even outside, some of them, even the advanced countries, some of them in their own country, they fear. So they travel outside to see their own medical doctors that they trust, who can, what do you call it, treat them. It's about trust. It's about trust. When it comes to healthcare, especially our leaders, it is about trust. In situations where people come to hospital, something happened to them, they die in the next couple of minutes, it's on social media and other things. Some people want to protect their privacy. And if it is their own money they are using, I don't see anything wrong with it. If it is state money, no, that one, we have the right to complain. But if not, then nobody should. Because there are some drugs that you cannot find here. Some equipment, we don't have them. Yes, somebody will say that, why are they not doing it for us? Sometimes it is not, what do you call it? Probably it's because they also have access to healthcare outside. That is why they renege on their responsibility to provide certain things. But when it comes to drugs, see, there are drugs, quality drugs out there, but if you don't have money, that is where the challenge comes. So there are specific procedures in place for the procurement, reception, storage, dispensing, and administration of controlled substances. Special ordering forms should be used. So you have procedures when it comes to the purchasing, receiving, storing, and then administering controlled substances. Sometimes before you administer, you need special ordering form to be able to do that. So let us look at other medicines. So note other medicines, including antiretrovirals used to treat HIV/AIDS, may need storage in a controlled facility because they are scarce, expensive, and in high demand. But antiretroviral, do we have private facilities or pharmacy shops selling it? I think these are restricted drugs that are sold by only the government. They are not even sold, it's given to people for free. And my worry is that assuming we don't have, if you don't allow private sector participation and the government controls everything, it means that when the government runs out of stock, that is the end of those who depend on it. So what happens? Are they able to buy some from pharmacy shops, or everything is still under control? Hello, I'm asking a question. Oh, you don't know?
So they are not. They are taken from the facility, really provided by the government.
Everything is provided, but the pharmacies are not allowed to.
No, you have to go there with your folder from the ART for them to dispense or issue the medication to you. You can't just go by mat and they'll give you.
All right. So in the situation where the government is unable to, but it's not something that is abused. It's a drugs that people can abuse it. Like it may have a negative impact on people if they take more than, like mostly those who take these tramadol, what makes it abuses is they take more than the quantity expected. What is the stigma? Okay. So let's look at examples of access control storage. If you have products that need increased security, you must establish access control storage. And this will probably include storing the product in a separate locked room cabinet or safe or log wire cage within the store. Sorry for so such items of high value, items that can the items that are sold in the black market. Normally the prices they get high price for it, and so they are always controlled. You don't give access to anybody, so you need to find appropriate storage zone to keep those items. Then ideally, a warning light or bell will be activated if those products are accessed improperly. So there are a lot of these are some of the security measures put in place to ensure that these products are protected or these products are not accessed improperly. Entry to the location of the access controlled product must be limited to the most senior storekeeper or pharmacist and one other staff member. So normally with such products that are stored in a security zone, it's not everybody who should have access. So you assign responsibility to those who are in charge of it. And normally the senior officers are in charge of such items. So let's look at the standard list of stock items. Each medical store should maintain a standard list of stock items that includes all products they handle with their specifications, including form, strength, quantity per package. This list should be regularly updated and distributed to sub-stores and units. So in your facilities, you have standard list of stocks that you can order. And you cannot order drugs that are not in your standard list, that are not in your standard stock list. And anytime you receive such stock, you are required to reject them because you are not supposed to. So like some of the drugs that we've mentioned, most of them, the smaller facilities, the polyclinic, some of the health posts, rural areas, like the clinics, normally the hospitals, the district hospitals, the regional, they may be in possession of some of these drugs, but the smaller unit, like the check compounds, health posts, they are not what we call it, given that opportunity. And then inventory records should be maintained for all products on the list. So the standard list of stock item is very, very important. That is the list you use to order. Anytime you want to make order, you go through the list, make sure the product you want to order are in it. Other than that, you will not be supplied. You won't get it. All right. Any question? Today, our lecture has for me, I haven't enjoyed the lecture because no contribution. And when it happens like that, you talk and talk and talk and talk and you become bored. Maybe Sabia.
Okay, so please, I wanted to make a contribution to the ARVs here that we spoke about earlier. So okay. The ARVs are usually taken from the units. They don't really have a stock at the pharmacies in the facilities where patients have to go and then take the medications from the main pharmacies. I think some of these measures are just to prevent the stigma issues. So their data is in the ART unit or the retro unit, and then they go there and then they are taken care of. So they don't have to go through the system which flows for everybody on outpatient basis. Yeah, so basically that's it.
Okay, thank you very much. Yeah. Austin.
Okay, sir. About what sister said, the drugs sometimes, according to the policies of the facility, in our place, the HIV people and those who are mentally ill have their own pharmacy. So when a drug is prescribed, they go to that pharmacy alone to go and take their drug. So it depends on the facility you find yourself.
Okay. But then the HIV drugs, what are some of the side effects?
Substance, I know of diarrhea, and some also have rashes. That's the two I know of.
The effect of the drug.
Yes, please.
Does it have mental issues?
I don't think so. Okay, I haven't actually witnessed anything like that before.
Okay, Theophilus.
Good morning, sir.
Yeah.
Currently, some of the drugs like Dobutavir and the rest, they've enhanced it to such a point that right now there's no effects unless you have a higher viral load. And currently, most of the patients, I had a prick that was 2 months ago and I took some of the drugs. What I experienced was insomnia. And then, yes, there was frequent nightmares, and I think that was it. But when I asked, they said,
Is it not because of the fear?
no. When I went back to check, they said they've enhanced the drugs. So now, if your viral load, there's no viral load, you wouldn't get any rush, you wouldn't get anything. But if your viral load is high, that's when you are going to experience some of these side effects.
All right.
Yeah.
Because I had Adelaide. Let me finish. When I come, then I'm talking. When I finish, then you come in, Adelaide. You know, I had a colleague. He's even dead. At a point, we didn't know what was wrong. Initially, said it was what do you call it, liver problem. And at a point, it got to a point that his conversation, like when he's chatting you, you'll be there and he'll chat to you, I need money, I don't have money, I need to do this. And sometimes you'll be begging, and we all know that looking at him, you shouldn't. And then looking at the large family, like talking about the large, what do you call it? It's a school, all student association, but then like our association was so close because we are seminarians, ex-seminarians, and then in addition to the priest, we all went to the same school. So when it comes to helping when someone is in need, I mean, it flows, the money flows. And even he wasn't our mate, he was our senior. But even my classmates, the amount we contributed was very huge. And at the point, I thought he didn't need our money. And also being someone teaching in one of the schools. But it got to a point in time, his thoughts, the way he communicates and the way he does things, that is when someone in the hospital alerted me that this is the issue, but he is in self-denial. And that is why some of those things happen. Someone was also telling me that it was the drug that he was taking that was causing that. So I don't know if that one, so initially I thought that maybe when you take the drugs for some time, you can also be exposed to some mental illness. But if you say that when you default, so when you default, do you experience mental, like this Lady Joyce, who was, the attitude of that lady, somebody was saying that is like when you take the drug to at a point you begin to experience that, I don't know, the other side effect of it as to whether they are just a coincidence or they are part of it. You are in that area, you have been administering to them. So what are some of the side effects apart from the vomiting, diarrhea? Does it have any mental effect taking it for some time or not taking it? Yes, Mercy. Message James, your hand is up. Can you talk?
Yes, yes. Please,
Yeah.
my own is yes. I had a prick and I had to take the ART drugs. I had hallucinations and there were a whole lot. So I think the side effects are there. Even when you force or not, they are there. But I don't know whether they have modified the drugs now.
Okay.
Thank
All right. Adley, your hand is up again.
Yes, sir. You asked a question, and I also want to throw more light on it. And just as my brother mentioned, he actually made mention of that the drugs have been modified in a way. Now they are user friendly. I had a prick and I didn't experience any symptoms. But the issue is that if you don't eat heavy, you feel dizzy, uneasiness, uncomfortable. But immediately you eat heavy, you are okay. That was the
All right.
only experience like I can say. And with the patient too, like when they come to the clinic like this, if you talk to them about it, and sometimes they give experiences that if they don't eat well, that is when they tend to feel such symptoms, just as what I mentioned earlier. So if you feed well, you eat a well balanced diet, you are okay, you are good to go.
Okay. Thank you. Okay, so without any comment, any contribution, we bring the lecture to an end. You can exit.
Thank you, sir.
Thank you, sir.
You're welcome. Hello, sir. Yeah, Ben, good morning. Morning, sir. Nice, sir. Face to face or Zoom? Online. I don't know where online. Online, next week online. Okay, Martin. But some can't also me back campus. Online. And next week, we are Sony campus. Next week, we are Sony campus. You know, program about the animal side, what we receive. Next week, one line of so Kenyans. Bye. Okay. Bye.
Saa na tie. O de ti bi n'anim na ọ na bɛ gyina aka wɔ asɛm. Yɛ ɔna mu sɛ afuna ɛyɛ ara ma tie ne nkyɛn mmarima bi na ɔmo yɛ anam akɔtena abɔnten so. Ɔhɔ na ofi a na yɛrɛ ɛma ofiri comfortable. Bɛyɛ ka no. Gideon.
No problem na daga tenu. Ah, they ask what this is.
Good day. We're go school. Goodbye. Yes. Probably just like oh. What say oh. And then também chegou. When you use the none of the coffee. And now you then you have to think one next one. And then that's it.
I'm tired of it.
I know it's young. But be not can't never S out. Be not can't in the mouth.
You are good with it. I will put down the thing. I say debut. That means the boss never unstilled. We can put sound still in the free. It's all right. We watch it.
Why is there any that cause an issue?
I am master. Yeah.
Over the
You know, maybe I think I print and I'm selling it. Now, I'm going to printing. There is a fingerprint in the code. When you go, it's in the I don't open my web access.